Hi, happy Tuesday with Tammy. Today I'd like to discuss a little wise wisdom advice about gout. And the reason for this is because this past 2 weeks actually, friends and clients have written to me or called me and wanted to discuss what they needed to do for diet change, etc. They were suffering from gout. And I'd done some research a few years ago because I had a family member that had it through his dad's side. And so it can be genetic. So we have to be aware. So let me first tell you what is gout if you don't know. It's a type of arthritis. Causes sudden and severe bursts of pain in our joints. That can lead to swelling, inflammation of the wrist, the knees, the heels, and especially the big toe. I hear it's so severely painful. Nothing I want to get, but doesn't mean, it's nice to be aware, huh? And it can cause kidney stones and uric nephropathy and tophy. So it causes other things as well. Like if somebody didn't know they had gout and they can go, oh, I have kidney stones. And yeah. So when does it occur? So it usually, majority of the time will occur because there's high levels of uric acid in our blood. And that's something, if we can prevent, that's even better. It's a combination of genes, diet, and existing pre-existent if you have 2 or more diseases, a person can be prone to get gout as well. So the 3 things: genes, diet, and 2 other diseases basically that can cause it. So high levels, of uric acid deposit in our tendons, and they can lead to inflammation and swelling and severe pain. Not good. It tends to occur usually, not always again, but, because there's other things that happen, genetics, etc. But people that usually drink regular beer consumption, people that are usually overweight, and have high organ and seafood, but not necessarily, of course, because I know very thin people who had gotten it as well. So, it's not cut in stone. But definitely lifestyle change. 1 to 2% of the Western population, dietary accounts for 12% of this. Probably more. I think personally that was just some study done a few years ago. I think it's higher. Yeah. There's a strong association with gout and consumption. Like I said, seafood, meat, usually organ meat, but usually it's high fat content, fructose sweetener drinks, and high excessive alcohol content. We're all different, so our bodies. Some can handle certain things and some can't. Individuals with gout should avoid shrimp, dried anchovies. Something I don't usually have, but maybe you do. Seaweed, that was surprising. I didn't know about that. Not like I have seaweed every day, but still it's nice to be aware, especially if somebody does have gout. Organ meats, beer, yeast, dried, and mushrooms are usually, high consumption, or somebody who probably, if you have gout or your doctor told you you have it, I would stay away from those foods for sure. Foods that help people that have gout, or people that are trying to prevent it as well, if you think that you have a predisposition for it. Tofu, which is a bean curd, because it's low in calories, high in protein, iron, calcium, and magnesium, which our body loves. And we don't want too much uric acid in our blood. That's what it all comes down to. Vitamin C. So basically, if you took, like, say, 500 milligrams of daily, of course, always check with your doctor, but vitamin C. And that could probably be in, in your, get some fruits, vegetables that have vitamin C. So it doesn't always have to be through pill form. And lots of H2O, water consumption especially, can just drown that out. Surprisingly, there have been many studies, and cherry juice, even just a tablespoon twice a day, wow, it'll be gone. Yeah, cherry juice has been on a lot of studies, so have some cherry juice. It's pretty yummy. Celery also. Lots of vegetables, but celery is one of those for sure. And complex carbs. And remember, the darker the berry, the better for you. Veggies that are low-fat dairy as well. And lean meat and poultry, low-fat dairy, as I mentioned again. Never hurts to mention twice, 3 times. Lentils, if you like them. I don't, but maybe you do. And it's surprisingly, people that drink coffee on a regular basis, I'm sure maybe it could cause something else, but there has been studies done that say, people that, not too much coffee, just a cup or 2 a day or something of that nature, they don't usually get gout. But again, I'm sure there's certain people that might, but that's just been with certain studies. Regular exercise, always limit calories, and treat yourself good. Take yourself to the beach or on vacation once in a while. Learn to relax and breathe. But again, dietary change, I think, is the key factor, of course. Naturally, if you have it so severe, you might have to take certain herbs, etc., doctor's medication, but until you get it down to not so bad, you can change with your diet. All right, happy Tuesday with Tammy. Enjoy the rest of your week. Ciao.